Hi, everyone. Welcome to Two Bald Guys Talking Safety. I'm Langdon DeMint.
And I'm Julian Taylor.
And welcome to our podcast.
Hello, and welcome to Two Bald Guys Talking Safety. My name's Julian Taylor, and the theme again for today is data.
It's showtime.
So I'm joined by my esteemed follically challenged colleague, Mr. Langdon DeMint. How are you, Langdon?
Good. How are you, buddy?
Yeah, I'm good.
We had such a exciting conversation last time. Now I think perfect opportunity to transition what we want to do with all that data and what can it be used for.
Because we talked about the pitfalls last time, didn't we? So let's try and make the conversation slightly more positive this week and think about
so scary.
So how we can use it in a positive manner. So I suppose, first of all, let's very quickly talk about the compliance piece. What sort of data reporting do you need to do as a health and safety professional in the States? What sort of data do you have to have?
That's a good one, because it's really, we get very caught up in setting new KPIs or trying to think, what can we do differently? When off the get-go, we know there's a lot we have to have from a data perspective, meaning you have to have all your incidents when something's occurred, injury reports, property. You have to ensure that everything's been documented, that you are reporting hazards. And, there's some, I guess I'll say maybe ambiguity on that aspect, because realistically, there's a lot of things, quote unquote, data-wise, I could not be tracking that obviously regulatory bodies might not know about till they come. Not saying you should do that by any means, but just saying, that one, you want to be more proactive. But just from a baseline compliance, which what we kind of we usually talk about is our congrats middle of the road. You have, every year, whenever something serious happens, we always have to document those incidents. We have to document what's been happening. And that's right. That's the important, that really is very important. I think we try to talk more proactively many times, but that is very important, because that helps create that foundation of what is happening in our workplace, so we can figure out where to go. Every year here in the States, I know HSE does the same thing, but we have Bureau of Labor Statistics. They release just excellent data, top injuries that have occurred in various industry segments, whether it's healthcare, manufacturing, blah, blah. It goes as deep as you want it. You can find out time of day, what type of demographic it happens to. So, there's a ton of excellent data, and that's strictly for what I'll say incident, injury type, event type, or exposure. All excellent data. Excellent, that has to be kept. And I think a lot of times where we see the difficulty is that transition, which I know we're going to get to. It's that, what do we do from all this excellent things that we are collecting to flip it a little bit, and how can we start turning the dial for a more positive? Because compliance, right, that's easy to, and I say it's easy. I know it can be difficult, but it's easy to ensure that you're documenting everything, that you have all the right programs in place, because that's data as well,
yep.
right?
Yep.
Ensuring that I have my health and safety program. If I have industrial hygiene needs, I have that. If I have chemical management, that's easy to ensure that you have that. But then when you want to get more granular, that's when it can get challenging to me, when you're trying to go a little more above compliance.
Because one thing, again, you triggered there was this thought of what the regulators want is a pretty low bar, isn't it? When you look at UK, you look at America, it's pretty similar. It's what's happened, isn't it? What's happened, what's gone wrong, where have people been ill, where have people been hurt, what happened that was dangerous. But there's not a lot in there that's really aspirational or looking to say, right, how do you really just get better as an organization, is there? And I think that's an area you can start to think about, is what metrics are you collating? And actually, yeah, let's deal with the compliance piece and make sure we've got that nailed. But then what's the useful data that we can start to collect that starts to help us to get better at health and safety as an organization?
Yeah, because I think that's a great point, because even when, let's say nothing's happened, right, in an organization, no incident, like let's hypothetical situation here. It's just a routine, and I'll use regulatory body OSHA, for example, comes in, does a routine inspection, or maybe it was a whistleblower. So nothing has happened. You start thinking, even from that standpoint, right, they're going to go around and see what can be found, might decide to look at some processes or programs, that's in place. But even then, you start thinking, how much proactive are they looking for? Because a lot of times it's not. It's looking for things that are maybe already existent. I mean, and I'm not arguing to the point of observationally. I think that can be very proactive and leading. But if it's an organization that hasn't tried to put new insight into improving, you're still living in the past. I know you and I were talking about before. There was an organization I was working with last year, and they collected a ton of data. And we started talking about it. Oh, that's great. They were diving into some of the aspects. And I said, so how real is some of this? Are you able to rectify these issues quick? Are you comfortable with what you're getting in? They said, well, that's the problem. It's all about 7 months old. And I did the Zeus. I tried to hide it. It was just a catch-off. What exactly do you mean? Well, we have someone that spends a lot of time, all the data we're looking at, it's between 6 and 7 months old. I said, so what is real time? Well, if something's reported, if it's truly serious, we see it. Everything else, real time is, and that was fine. So real time was 6 to 7 months back. So you think about the importance of data. That right there shows that they saw the importance of data, but they didn't know how to actually handle that or manage it or whatever you want to call it.
So what do you do then, Langdon, to rectify that, where people are living in the past? What are some of the things people can start to do to just make it so that the data is more up to date?
That's way to throw a curveball. That's challenging, right?
Yeah.
Because if the organization, and I think they were collecting great data. I mean, we talked about a lot of it. And when I say that, I know I'm being very vague, but I mean, it was down from incidents to when hazards were reported, to just general observations, to learning moments, corrective actions. And we did have a discussion around prioritization, kind of that realization. And for them, it was pretty much, if something is what I would call a OSHA reportable, so like your amputation, your loss of arm, loss of life, or eye. I mean, it was the super serious, they were taken care of. But everything else, there really wasn't a lot of prioritization of data, of actually looking back to see. So, off the get-go, it was very much, let's talk about what we're getting in and maybe start thinking, how can we focus on what's coming in so that we can learn from it? Because I feel like when you have that much, it's great, but you have to start thinking, how can I use this to at least get up to speed? And that's challenging.
And there's a whole bunch of things, aren't there, that can affect this. So thinking about things like, just the experiences we've had in our time is you go and look at organizations, and the way that the data is collected is just completely inconsistent. So if you have a multi-site, multi-department, multi-team organization, you go from team to team and they're all doing things differently. So it just means that it becomes really, really hard to collate that information and use it in a meaningful way. So I think one of the first steps is to look at actually, how do I collect this data? And how do I do it in a way that actually everybody's collecting, we're collecting the same thing from everybody. So we're using the same terminology, we're using the same forms, we're using the same tools. So actually it all flows into one central repository, and it just makes it's easier to make sense of it. It's the biggest challenge is if everyone's using different terminology, actually trying to align what one person has said to what another person has said becomes a nightmare. And that's where you see health and safety teams just wasting, and I'm going to be that blunt, wasting a whole load of time just messing about with data. And is that what you went into health and safety to do?
Well, I think something you just said triggered. I think that's right, because you think about it, and this is potentially slightly controversial, maybe not, I don't know. But, you and I've talked numerous times. We've worked with organizations like this. I mean, I've been a part of an organization managing it. There's a lot that started, and I'm going to use near misses as a perfect example, because it seems like when that came about, I'll say when it came about, it's been around, but I mean, as it's become more prolific in the last few years, you see people really began diving into that, right? Let's calculate, let's categorize, let's get all these near misses. And I've worked with some where they had 30, 40,000 near misses, and you just kind of stop and you're like, well, we don't know what to do with all this. Like, well, it's great that you're getting that. That means that you have people engaged, that stuff is happening, but you don't have to go through all that. And that's I think the difficulty some places see. They want to capture the data. They want to capture those insights. We'll just use near misses again. But then they get so much, they do nothing with it. And you still have to realize, hey, that's kind of like the BLS. You have all these instances of close occurrences. Now you just prioritize what's frequency, what's severity of the ones that have come in. I mean, it might take sometimes a little kind of looking through, but if you stay up to date, I mean, now, right, if you're having 20 a day, okay, it's a different conversation. But if you're getting so many, every week, and you just set time, almost set an hour to go through what do we have coming in. If you haven't done it as soon as it came in, that's still an excellent time to learn, to say, okay, we had a couple of things that nothing happened, thank goodness, but that could have been, SIFs. I'm thinking about, that's a perfect opportunity. How does that kind of, when you really start wanting to manage a serious injury fatality, it's a lot of times to learn how to think differently. It's post-incident, and then you start backtracking. So to me, that's an excellent prioritize.
Yeah. So I think you need to prioritize. I think one of the things we've talked about this so often, people have too much data.
Mm-hmm.
And you look at, does that data ever actually really get looked at? Does it get used? Do people get any value from it? And they don't. So sometimes there's a case for less is more. So actually restrict what you're collecting, but collect stuff that you're going to use and you're going to use in a meaningful way. And it's one of the things that still kind of astounds me is that we're in 2024 and there's still this focus from a lot of people on incidents, which is great. Yeah, I know we need to look at incidents, but actually shifting the needle slightly so that people say, okay, what data are we going to collect? Let's look at collecting observations, or let's look at collecting hazards. And the starting point before you even do that is then to go and educate your business and the teams across your business into why do we want you to report this stuff? What's the value in it? And because if people understand the why, they're just more likely to actually report it. What's in it for me is such a useful sort of approach to this, is helping people to understand the personal value of actually submitting safety information. They're more likely to do it. So actually you start to then collect meaningful data that you can do something with. Because if you start to collect hazards and you start to collect observations, that stuff, like you say, we don't wait for the serious incident or the fatality to happen. We start to deal with stuff before it happens. So you start to make a difference. So I think less is more is a really important point. And then I think we touched upon it on the last episode, the spooky episode, but I think a really key bit kind of aligned to that is that employee engagement piece. So So actually, why won't people report stuff? Yeah. And so education is a key part of that. Educate them into why we want them to report that. But then you've also got to create this psychologically safe workplace where people don't fear the repercussion. I nearly said fear the reaper there because there's a song in there.
It's a good song.
But don't fear the repercussions of, if I do report this, what happens? Yeah. So we start to get more people reporting more stuff. And I'll put in a bit of a plug here. We've got a guy coming on the podcast. I'm not going to give away too much too soon, in a few weeks' time. And he's going to talk about sort of behavioral styles. So again, actually just the way that people think and the way that people behave as part of their natural makeup can make the difference into how they're going to do stuff. Are they going to report stuff? Are they going to do things in the right way? So again, when we start to think about employee engagement, what else can we bring in or factor in to actually make our employee engagement better? So again, I've thrown loads at you there, Langdon.
No, I think it's good. It's, to me, one of the things that's pretty interesting. We think about, we're in a world now of everyone seems to talk about AI, artificial intelligence. To my knowledge, which is pretty, let's be honest, pretty simple here. A lot of that AI, what is it driving from?
It's still driving from human underpinnings
and data, all past data that's been come up. Whether it's, I know you could go to whatever, Chat GPT, some of that stuff, and type in, give me the best health and safety program. It's not just pulling it out of thin air. It's pulling it from stuff that people have put in. It's pulling it from websites. It's pulling data. It's pulling crap that's already been done, so to speak. And I don't mean that negatively, but so you think about what's the importance of how we can use this. It's very much, there's the compliance, there's incident prevention. We want to improve operational efficiency, try to create better, more proactive organizations, create more robust risk management. That's all how we always make these vital changes to organizations. It's been through understanding what data we have in place so that we can figure out where do we need to spend maybe a better, more refined focus so we can improve. That's...
Yeah. Maybe we should get one of our AI experts on the call and one time and let's talk AI. It's interesting, isn't it? Because people have different views on its usefulness. My suggestion would be test it and try it. I think the experiences I've had is it can be brilliant. It can come up with some great stuff, but it still needs a sense, I think, of sort of human checking at the end of it to make sure it's right. And I know we've looked at how you could use it in things like hazard reporting, so it will easily summarize a hazard report, which that starts to become quite useful, doesn't it? If you can get some kind of summary at the bottom of a report, which makes it easy for somebody to digest something more quickly. Great. But you still need that sense of sort of checking at the end of it.
Well, I think to that point, it's when we think about what we talked last week and this week, obviously there is that whole element of compliance and of being more proactive, but everything that I feel like our theme, if we had to really think about a theme for the year, it's been various aspects of creating safer, healthier operations, and then kind of, engagement, whatever that is. And that's probably a theme that forever is lasting, but understanding what you have even helps you understand what you don't have, like a gap analysis. The whole purpose of that is to see what you have, what you're doing well, but then also to identify where are areas of growth. And that's the same thing with data. When you collect all this, it's, again, I love looking at BLS data. NSC's put a lot more refined in there. I know HSC does the same thing. It's all great. And it can help us be more proactive, but really that's one facet. when we think about how to have a safer, more effective organization, there's a lot more data that we can take in place. And you hit on earlier for that engagement piece. Well, if you have an engaged workforce, not only do you have a healthier and safer, but then you're going to have a more sustainable, better employee morale. So you start thinking there's a lot more data points that are intertwined that we don't always take into account.
Yeah, I think that's a really good point, which is actually for safety people to look outside of the safety sort of remit and say, what are the data is being collected across the organization that we can link into these safety metrics to maybe get a better picture. So that's a really good point. One of the other challenges I think that we hear all the time is sort of a lack of resource. We've only got a small safety team. And it comes back to your point around engagement. We're actually, I think the solution there is we talked about it earlier, is prioritizing what metrics we want to collect, but then also make it easier for people to collect data. So make it really simple, make it mobile, but then also broaden out who can collect that data for us. So get away from it being the safety team needs to do this, to actually it's part of the day job. We talk about safe operations. It's part of the day job for everybody across the organization to do these things. So whether it's creating a risk assessment, whether it's reporting a hazard, whatever it might be, it's not down to a small safety team to do that. It's a collective. And that way we start to pull in more data from more people and we get a better picture. Yeah.
No, that's a great point.
One that's a bit sticky is data privacy. Yeah. Any thoughts on, because that's something that's sort of become more and more prevalent over the last few years.
I mean, here HIPAA. It's the magic phrase. No point in even going into that. I think that's a whole different, well, I'm not going to say a whole different. It can be intertwined, but I think, yeah, I don't want to even get into
that. I think on data protection, I'm not an expert on data protection. Again, we have got an expert.
Yeah, we do.
Yeah. But I think a big part of it is sort of that communication in terms of what data is being collected, why, what kind of retention periods do we have around that data, yeah, and getting that consent where necessary, if possible, up front and around the collection of data. And again, there are legal requirements where it needs to be collected.
Yeah, to me, I think the data privacy was always a little, I'm not going to say confusing. When you have an incident or something, especially I'll say this during COVID, I don't want to go too far into this, but when you had instances where you're not supposed to say anything because it's privacy to the person, and I don't mean that negative by any light, but an infectious disease is an easy one to discuss. If somebody got something when traveling for work, you have to be so careful in how you present that to the wider, even if word's gotten out, right? You can't say that because that's that person that's protected. But then you think about, well, how can I train others to ensure it doesn't happen? And that's I'm not saying that we shouldn't have it. I don't mean that by any means, but that's why I was kind of like, that's a difficult for this purpose. But
yeah, and I think one of the great things about technology is that you can put the sort of processes in place that actually we can be very tight around the way that we protect people's private data, can't we? And who can see that data. So it's quite easy to put the barriers in place that need to be in place to make sure that we are looking after and protecting that data. Yeah.
Mm-hmm. Yeah. Okay. I think that's people's privacy deserves to be kept. I meant that for sure, but we just have, data, albeit, and maybe this is kind of that theme we were talking about. All data is great. It provides that insights into what's happened, but it's all about transitioning it and how can we be more proactive. I think that's the learning opportunity.
I think that's the key thing for me is data for the sake of it doesn't always have value.
Mm-hmm.
So
Totally agree.
it's actually collecting data that is going to help to improve your organization and keep people safer. That's where your focus has got to be. It's got to be a focus on actually collecting good data that adds value. I think that's probably a good place to wrap it for today.
I agree.
We could, you all know both of us, and we could keep talking forever, but I think collect data that adds value is a great way to finish.
As you're going about your work days and contemplating what data to collect, what data can I get better at and learn from, just remember that all data can be good data, but then prioritize and understand what we can learn from it, because that's what we're all trying to do. So as you're going and collecting your data, remember to stay healthy, stay safe, watch each other's back out there. Thanks, everyone. Thanks for tuning in to this episode of Two Bald Guys Talking Safety. Don't forget to follow and subscribe wherever you stream your podcast, or you can visit us at evotix.com.
And if you've liked today's podcast or you found some value from it, we'd really appreciate it if you could head over to Apple Podcasts and leave us a review or a rating. It really means a lot to us. Thank you.